C5-C6 disc bulge, or C5-C6 disc herniation, or C5-C6 disc protrusion. If that's what your MRI report said, you cannot go another day without being aware of these 5 serious signs and symptoms of a severe C5-C6 disc bulge or herniation. And that's what I'm going to go over in this video as a public service announcement. I've been a chiropractor for now 24 years, going on to 25 years. I'm a corrective care chiropractor in Vaughan, Ontario, Canada, and I've seen it all. We help people get through these serious conditions like C5-C6 disc bulge or herniations in the lower back by analyzing them, full spinal analysis, and giving corrective methods to correct the underlying cause that causes disc bulges. But sometimes we get cases where we start to see severe symptoms of progressing disc bulges and herniations. Today we're going to talk about the neck. So pay attention to these 5 serious signs of a severe C5-C6 disc bulge. I'll tell you exactly what to look out for. I'll tell you exactly what to do. And then stay right to the end because I'll share with you a story of a patient of mine that had some of these symptoms and what we did, and also the kind of testing that you need to get when an MRI is not enough to evaluate what's going on with the cervical spine, with the neck. We'll talk about that today, so pay attention and follow along. Now, there can be many different causes for a C5-C6 disc bulge or herniation. Some of them can be traumas like whiplash injury or sporting injury, like a blunt hit trauma to the head or neck, a fall. And sometimes it can be just slow, repetitive micro traumas over time, like bad posture, bad sleeping positions, working in a bent forward position, or some kind of postural or distortion or spinal misalignment. So very simply, before I get into the details of these 5 severe symptoms of a C5-C6 disc bulge, if we look at a spine here, the neck should be a circular shape from the side, and then from the front it should be straight. Anytime it's out of position, it's going to create abnormal loads on those discs and cause them to weaken and tear, and they can cause disc herniations, protrusions, or bulges. Now, what the 5 symptoms are related to either severe pain or radicular symptoms of the hands. And the first one I want you to pay attention to is progressively worsening neck pain. So warning sign number 1 is when neck pain associated with that disc bulge injury is getting worse and worse and worse to the point where you now have limited mobility in your neck, stiffness. And I'm not just talking about like you're going to the end range and you actually have some stiffness at the end range. I'm talking about you can't move beyond this point here, or you can't move beyond this point here, okay? That's a serious warning sign of a severe, possibly severe C5-C6 disc bulge that needs immediate attention. And in that case, if you need urgent care, there's a hospital, there's medical doctors, there's pain relievers and medications. You have to go to the appropriate doctors for that. And of course, physical therapy and chiropractic to help get some mobility back in there. Number 2 is shooting pain down the arm. Now, why is that relevant? And I'm talking about severe shooting pain down the arm, and even more importantly, if it's both sides, which is not really typical. Usually going to be on one side. Severe numbness and tingling into the hands and fingers that are progressively getting worse. Why is that relevant? Is because if you look at the spinal anatomy here in this nerve chart here, we're talking about the nerves in this section here. So C5 is right in the middle. C5-C6 is the most commonly injured joint, vertebral segment, motion segment, and also disc. And when there's a disc bulge in there, it'll actually compress that nerve that goes into the arm. Those nerves make up the brachial plexus. They go right down, all the way down to the finger. So a compression on the nerve from a C5-C6 disc bulge, if it's large protrusion and large compression, severely causing a bunch of pain in there, it's going to cause severe pain down the hands into the fingers. Okay. Now, number 3, this is very serious, and I'll talk about a patient of mine that had this as well in a moment. So keep watching. If you start to lose grip strength, okay? Now, sometimes you're going to be aware of that, sometimes you're not. So how would you be aware of it? Is if you're holding your cup of coffee with your left hand and it's no problem, but your pain is in the right hand, you hold a cup of coffee and now you're dropping the cup of coffee. That's not normal. So in our office, what we do is we use a hand dynamometer. I use the Camry device here, and I actually have our patients squeeze this as hard as they can, like that. Now we set up in a certain way, okay, in the exam, I'm just showing you up here. So I got 90 pounds of pressure. That's not even trying, okay? But we use a hand dynamometer to measure their actual strength on one hand, and then we'll use the hand dynamometer to measure the strength on the other hand. So I got 69.2 on that side. So I'm right-handed, so right-handed should be stronger than left-handed, okay? But what I do with the patient is I'll actually compare right to left and make sure that it's pretty close for them, okay? Because there's a lot of variability with hand grip strength. Now, if they're right-handed and their left grip strength, let's say, is 90 pounds, and their right grip strength is now 40 or 50 pounds or 30 pounds, that's not good. That's a severe symptom of weakness in the muscles of the hand. The muscles are controlled by these nerves up here. If there's a nerve compressed because of a disc bulge, or disc herniation, or disc protrusion at C5-C6 or somewhere in the neck, that's going to cause an issue. Next, number 4, another serious symptom of severe C5-C6 disc bulge is weakness of reflexes. Okay, and this can also be other disc injuries in the cervical spine as well, not just C5-C6. So we check reflexes, biceps reflexes, triceps, brachioradialis, and if we don't see any reflex in there that's occurring, or it's diminished or weak, then that's a serious neurologic condition, okay? So someone needs to get that checked by a neurologist. Number 5 is now muscle atrophy or muscle weakness. Again, that's a severe progressive symptom of nerve compression. So we can take a measuring tape, wrap it around the biceps muscle and measure one side, and then go to the injured side and measure and compare. And if there's a remarkable difference, if there's a loss of muscle girth rate, then that's going to be a problem, and that's another sign of a severe C5-C6 disc bulge and herniation in the cervical spine. So those are your 5 symptoms. Now, what do you need to do? So most time people come in with MRI studies on hand. But one of the things that was never really looked at was the actual spinal alignment. And that's where we look at it from a structural corrective care chiropractic point of view. And stay with the video, because I'll show you a story in a moment about a patient that went through some of these signs and what we did to resolve them. So we want to see what the normal alignment of the spine is. It should be circular from the side, and we can check this on X-ray, and it should be straight from the front. And if there's a misalignment or a structural distortion, then that's going to cause problems. Now, usually when someone has a disc bulge and there's a structural distortion, we want to rule out instabilities, abnormal motion of the spine, too much movement. So we now do a test or an X-ray, special X-ray to check for that. And one X-ray is called the flexion study, where we hyper flex the person, take an X-ray of that, and then hyper extend them, okay? Take an X-ray of that, and we check now if there's any extra movement by measurement of millimeters and degrees compared to neutral. So it's a flexion extension study, and that will give me a better idea if there's any actual ligament damage in relationship to the neck pain, the arm pain, and the disc injury. And then we apply either relieving techniques or corrective techniques, depending on what stage the patient's in, to actually help them. I use a technique called chiropractic biophysics, of which I'm advanced trained and certified, to help get to structural corrections of the cervical spine. If you check any of my other videos about C5-C6 disc bulge or cervical kyphosis or military neck, you'll see a lot of techniques that I show on those videos on how we do this. Okay, so let me share you a patient story now. I had a patient that came in. He's a construction guy, and he came to me one day, and he said that he was working under a section, I think it was like a deck or something, and he forgot that he was under there, and he got up real quick like this, and he struck his head so hard, he didn't pass out or anything. He struck his head so hard, so he gave himself like a compression-style injury into his neck. And he came in that day, and he said he couldn't move his neck at all, number 1. He had shooting pain down the arm, 2. He had numbness and tingling, 3. And I checked his grip strength. It was remarkably weaker on the right hand compared to the left hand, and he was a right-handed individual. We did X-rays, we did flexion extension, and we started to work with him. Now, he did not get an MRI. We didn't get to that point, although I told him to go see his doctor for an MRI. I told him to go see his medical doctor for a neurologist. One of the tests you might want to get is nerve conduction test by a neurologist, or EMG test for the muscles. So nerve conduction tests test the actual pathway of the nerves if they're firing properly, and the power of the nerves, and then EMG tests the actual firing of the muscle. So those are both done by a clinical neurologist, so your medical doctor can refer to that. He didn't want to go get those done. We treated him, and within 4 weeks, he had no more neck pain, he had no more arm weakness, no more numbness and tingling, and he had full range of motion in his neck, and he did great. So corrective chiropractic care can be very useful as long as we rule out a lot of the things that could contraindicate any type of treatment. So I hope you found this useful. If you did, and you found some value in it, just like and share the video so other people can actually discover this. And I'll just give you a playlist where you can learn more about the corrective techniques we've done for the cervical spine, for C5-C6 disc bulge, for cervical kyphosis. Go check that playlist right here to learn about the corrective techniques for these type of injuries.